Hi there, Craig Osborne. A question which pops up quite frequently is which technique is better? In chiropractic, there is approximately, if not more than 100 different techniques. That doesn't mean there's 100 different ways to move a bone, which is the typical kind of chiropractic care. The question is, how do we decide which one to work with, and possibly how are we going to do it? And there are all sorts of techniques that take you right from sort of energetic and tone type treatments through to what you probably think most classically of chiropractic, which is the adjustment with the bone popping. And so what I wanted to talk about is just a little bit of how do you distinguish between them, and it's not really even a case of deciding if one is better for you, but just to appreciate why that isn't really even a necessary question. So the understanding is that most chiropractics, of those 100 plus techniques, are probably going to use some kind of mix of roughly 10 classical treatment or protocols when they decide how to adjust you. Most of them are going to be your classical type of adjusting, and essentially what we can use to do that, of course, chiropractic means, the word means with the hands, but that doesn't mean we don't use other things as well. So there's a technique called Activator, and there's different types of devices that can be used mechanically to move the joints. There are all sorts of table little tweaks that we can use that add a little bit of impulse to the adjustment, because the faster the impulse, the adjustment, the less force that needs to be used. And so this table here has also segments for other parts of the body. Makes a lot of noise, but in the end it actually makes the adjustment softer for the patient. You'll also see in the background, my second table also has a center pylon, which lifts and lowers. Now, some other tables, which cost an awful lot more than this one, also have flexion, distraction, and movement parts in the center that are very useful for decompressing discs for those chiropractors who are into specializing into that kind of care. Appreciating which technique is better than the other actually comes down to a very important point, and that is, in chiropractic, we don't have an awful lot of research. The reason for that is we don't have, like the medical fraternity, we don't have the money from the drug companies pushing different research to support what's going to earn the most money for the next company. We have a bunch of individuals all doing their own thing with the expectation that somewhere, somehow along the way, someone's going to do some research. So of all those protocols and techniques that we know, the research that's been done has, if you like, 3 stages. And the first stage, bear with me here, takes you from doing what we call basic science testing, saying when we push something, can we measure a change in something? For example, we know that we can measure a change in some immune system measurements. We know that there are some other changes in terms of how well you can breathe, all sorts of different changes in this regard, basic sciences. The next step is what the drug companies do, which takes a lot of money, and that's taking it to a clinical test. And that's where you apply the adjustment, perhaps measure what's going on, but then assess how patients are actually responding or what this means for them. What we don't have a lot of is this A to C. We have a lot of A to B, if you like. The thing is, though, we notice from this patient perspective what chiropractic adjustment helps and how it can help. But we don't understand scientifically, and don't have the proof, if you like, how that actually happens. And it applies, the reason for me saying this applies to the techniques, because we don't even have the different research to say if one technique is better than the other. But what we do know through some of the research done by one of our top researchers, Dr. Heidi Horvick in New Zealand, and that is that it looks to be that the more proficient the chiropractor is in his or her technique, it doesn't matter what it's called or what it is, the more effective it will be for you. So what you want is someone who's good at what they do, but what they do probably won't make a difference. Sounds rather interesting, but I thought that might be useful for you. Of course, at the end of the day, there are some techniques that perhaps you just don't like and don't gel with, and that's an important part of the healing process. You have to not really believe in it, but you have to have a connection with the person who's offering to help you out of your problems and improve your level of quality of life. And so having a trust to what they're doing and that it's going to help you is just as important as those other features as well. Anyway, I hope they found that interesting. And of course, I'm here in the Chiro Lounge here in Lindau. If you're interested in help, you are always welcome to make appointments on my online page, chiroloungelindau.de, on the appointment page. Have a great day. See you later.